question is on libido. I can understand some impairment of sexual function is expected. I'm having a hard time to get aroused or interested when my husband initiates it. This makes me depressed, and how do I address this loss of libido and help control depression?
What's her name again?
Liz.
Liz, me too. This is a major problem for women undergoing cancer treatment or not. It is an issue that tends to be neglected and ignored and very difficult to address. First of all, a lot of people don't have a lot of physicians don't have the knowledge how to manage this. Again, tricky symptom, but I wanted to let you know that this is really common in survivors of breast cancer. It does not mean it should not be treated or managed. First of all, we make sure there is no physical issues, and if they are, they should be addressed. Sometimes this vaginal dryness and painful intercourse can be a source of being afraid to try again. So the vaginal dryness and the symptoms, physical symptoms, should be addressed first. The second thing, there are some antidepressants that can decrease the libido and sexual interest, especially the serotonin reuptake inhibitors or SSRIs, the family of Prozac and its cousins. So I usually switch to a medication called Wellbutrin, which is still an antidepressant that works well, but does not affect the libido or sexual function, actually can enhance it a little bit. So these are the top things: physical problems, switch antidepressants, or even use an antidepressant that spares libido, potentially helps it a little bit. But the good news is there are 2 FDA-approved medications for this issue. Finally, women are heard. I thank you for that question, Liz, because I did not know that there was a second one. I was aware of the injectable one, but there's an oral medication as well. So I will mention the names. They are very tricky, so I'll spell them, and feel free to discuss these strategies with your physician. And sometimes if physicians lean on a social worker or somebody in their practice that deals with the consequences of side effects and sexual health. So either way, whomever the person who's going to be helping you, you can mention these 2 medications. The first one is called ADDYI. I do not know how to say that. That is the oral medication, and it's used as needed. It has some potential side effects that you'll be discussing with your physician, but typically very well tolerated. And the other one is VYLEESI. This is injectable, that's used as needed versus on a daily basis in the oral medication. The other one is only as needed, so it's VYLEESI. So I would do some research, look into this, and speak to a physician about it. I'm so glad that there are options for women to help the symptoms.
Very, very helpful response. Thank you, Dr. T.